welcome. You're watching Health and Wellness Save a Life. Every life is indeed invaluable and precious. The problem of a sudden cardiac death is a major concern all over the world, affecting people of different age groups. When it comes to India, the problem has escalated due to the sudden change in lifestyle and food choices that are available. When medical emergencies like cardiac arrest happen around a person, it is important to be prepared. If you're aware and informed, then you can take steps to revive a person and therefore save a life. Worldwide, millions of people die of sudden cardiac arrest every year. This is partly due to limited and sometimes ineffective bystander cardiopulmonary resuscitation, or CPR as it's popularly known. Many adults in cardiac arrest can be revived with intact neurological function if the bystander can provide immediate CPR. Raising public awareness, therefore, and an understanding of practical implementations of CPR is an essential strategy to increase CPR success in cardiac arrest cases. It is even more important to learn about CPR if you have a loved one who has a history of cardiac disease, as research reports that a majority of cardiac arrests occur at home. Save a Life is an initiative through which people can be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and be trained on giving CPR if the need arises. Today we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR to revive and save a life. We have with us Dr. Professor KMK Reddy, Senior Interventional Cardiologist, Senior Consultant, Apollo Hospital, Ramya Heart Center, Hyderabad. We also have Dr. Sandeep Kadam, Dr. Kadam Heart Clinic and Diagnostic Center, Pune, Dr. Manbir Singh Khurana, Senior Interventional Cardiologist, Ludhiana Mediways Hospital. Dr. Kadam, people around the age group of 30 to 40 years of age also suffer heart attacks and have severe heart problems. What is the main cause of a steep increase in heart problems among younger people?
Actually, India is a hub of diabetes, first thing. So diabetes is major risk factor for the heart disease. If you see all young people in India, typically the age less than 40 people have more chances of heart issues, mainly the heart attack. Again, the chances of getting multiple blockages is very common. Again, the hereditary is also common. Second most common thing is the COVID. After COVID, there is a hypercoagulable state, and that leads to the clot formation and heart attack. Third is the sedentary lifestyle. Because of lockdown, and especially in the IT sectors where they working from home from say morning 8 to till night, and sitting on in front of laptop without any activity, so that leads to again a risk factor. Other factors like smoking, high cholesterol, which are usual one, and sedentary lifestyle. So all these together leads to the more, and most important is the awareness. Now there is a early detection of the symptoms and diagnosis, which was not 10 or 15 years before. So all this contributes to the major issue with the young peoples.
Right. Dr. Kadam, what's the first thing you should do when you see someone go into cardiac arrest?
First thing, you need to call for the help. Start CPR. The chest compression, it should be at the rate of 100 per minute, and it should be 2.5 inches, what we call as a high quality CPR, and you should give a breath after every 30 compressions. And most important is allow the recoil of the chest. So you should take a proper high quality CPR training, and that should be continued till the other teams or medical health resume. The most important thing, this CPR training should be done from the school level. I think we should include it from standard 8 or standard 9, which is good options to educate the people, and that will prevent lots of life and lots of death.
Dr. Kadam, are there any precautions people with heart diseases should take to prevent having an episode of a sudden cardiac arrest?
The most important is they should be regular with their medicines. If a patient who undergone for any heart surgery or angioplasty or any other surgery, he should take the blood thinners according to the cardiologist's opinion, and they should not be stopped on its own. Many times what happens, these people stop the medicines, blood thinners, and that leads to the catastrophe, and then things get worse. So this is most important thing. Second is regular health checkup. Regular health checkup, there are some parameters that should be taken into the consideration, like ECG, two-dimensional echocardiography, and stress test, and some blood tests like cholesterol test, some cardiac risk marker tests that should be regularly checked up. So all these things prevent the second episodes. And first and most important thing, do not diagnose this on your own. Many patients lost their life just because they diagnosed this chest pain could be because of acidity. I came across at least 100 person who diagnosed themselves that it's acidity. They came to emergency and they found to have a heart attack. So heart attack pain is a classical pain. It's a red flag. You never experience in your life. First time in the life, it's a kind of severe pain. It can be there from jaw to the upper abdomen, in the right shoulder or left shoulder, on the front side or back. So it's not that it's a left hand pain or left sided chest pain is a heart attack pain. Heart attack pain can be anywhere in this area. Second thing is the uneasiness. Third is the sweating episode. All these together need a emergency or urgent medical help, medical checkup. So be regular on the medicines, health checkups, and follow the instruction of your cardiologist. That will prevent the further events.
Right. All right. Well, I'm afraid we're out of time and we'll have to leave it at that. Thank you very much, doctors, for joining us.